Welcome, welcome. We have a good turnout today. I'm excited. I have, okay, I'm the host now. So I'm getting ready to share my screen so that we can get started because you all know how I try to be about time. So let me know if you are able to see my screen, the Full Circle Women's Care Pregnancy and Practice Orientation. I see the hearts going up. Love it. All right, I'm your host, Dr. Adams. And some of you I've already had your history visit with me, and we were able to start some of these conversations. And I gave you a little cliffhanger and said that we would continue them today. So I hope you have your questions ready, your pencil, your paper, because we are off. So, first thing, confidential. No one can tell if it's you asking questions. If I think you are asking a question that may make it too obvious who you are, then I may say, hold on, we'll answer that at your visit. Otherwise, I will answer questions as they come in. There may be some that I'm like, oh, you know what, I'm going to get to that in just a moment, put a pin in it, and then we'll come back to it. So please participate. And then at the end, if you have to hop off at any point, I understand this might run into dinner time. You can watch this on replay on our YouTube channel for the duration of your pregnancy. And we are starting out. Oh, there's an echo on her end. Can y'all put your thumbs up if you have an echo also? Um, Somebody else has an echo too. Ooh, hold on. Let me make sure I'm not signed in multiple places. All right. Is that better? Is it still there? Okay. All right. I don't see any thumbs up that it's still there, so hopefully that got rid of it. Okay, let's go. Today, we're going to be talking about the full circle experience, which includes where we deliver. We're going to go through some office protocols, talk about what to expect at your pregnancy visits. I'm going to give you a ton of prenatal resources. We're going to go in depth on exercise and nutrition in pregnancy, and then we're going to end with an upper respiratory illness update. So, first, tell you about our practice. We are a collaborative midwifery model practice, which means that we believe that pregnancy and birth are normal life processes, not a disease that you caught that we have to cure. Similar to the traditional midwifery model, which cares for normal low risk women. But if you develop any issues with your pregnancy, if you develop high blood pressure, then you may lose access to midwife care in labor and have to transfer out of that practice in order to be able to access physicians. In the collaborative model, you're still able to have midwife care for labor and delivery, but you have physician direction for the prenatal course part, where we're watching for any issues that may direct how labor and delivery needs to, or when labor and delivery needs to happen. So labors and deliveries are still attended by certified nurse midwives. If there is something that happens during your labor that is outside of the scope of a midwife, then they call for physician consultations. That's the collaboration part. So if it's something urgent, like can't wait till morning, not true emergency, they'll call us, me, Dr. Marrow, Dr. Mooney, because we're always on call backing up our midwives. And if it's something emergent, like because all of us live maybe 15, 20 minutes away from the hospital, if you don't have 15 or 20 minutes, the hospital is staffed 24 hours a day with board certified OBGYNs for true emergencies. And I put this little stat in here as just kind of to let you know how often that actually happens. We did about 600 deliveries in 2024. 4 times we needed the hospitalist. And I'll tell you even further, 3 of those times it was because the midwife was in another delivery or the woman came in 10 centimeters and there wasn't time for our team to actually arrive. There was only one time that it was a true need to go to the OR emergency for a doctor out of 600. So where do we deliver? We deliver at HCA Hospital, which is formerly known as Memorial. And we've been there now for almost 3 years. It's been an amazing move. It is less than 10 minutes from our office, and we invite you to take a tour of the facilities. We'd love for you to see it. We have a tour actually tomorrow, but it's full. The store tours are currently being done quarterly, but we realize they're always full, so we need to have more. So hopefully before the end of your pregnancy, we'll be increasing that frequency to every other month. But the next one right now is slated for August. So you'll see when you come in for your visits, it's a colorful sign that tells you when you can tour the facility, when you can do a stork tour, and you just sign up for it. If those dates don't work for you, though, you can always go to the HCA website and click on register for a class, select labor and delivery tour. That's the name of the class. And then you just pick a date. Brittany, our childbirth educator, does those twice a month to help accommodate more people who aren't able to make it to the stork tours. Our office is open Monday through Thursday from 9 a.m. to 1 p.m. We then close for lunch between 1 and 2. And during that time, the phones roll over to the after hours line. So if you call the office between 1 and 2, you're going to hear the voicemail that says, you've reached the after hours line of Full Circle. It doesn't mean that we're closed or we've abandoned the phones. The reason we do that is because the after hours line rings to the emergency on-call provider. So if you're having a medical emergency between 1 and 2, you can still get in touch with her. However, she does not relay messages to the front desk for administrative issues. She just calls back people who are having clinical problems. So if you're having a clinical problem, we do reopen Monday through Thursday at 2 p.m. and then we are open until 5. On Fridays, we are open from 9 to 1. So if you are calling at 12:53 with an administrative concern and you leave a message for it, if you call back 10 minutes later, the office will be closed and the on-call provider will relay that message to front desk, but she will not be able to call you back because she can't usually handle whatever the administrative thing is. For appointments, we don't have walk-in appointments here because our goal is to see you at as close to your appointment time as possible. So if I give you the 10:20 appointment and someone walks in at 10:13 saying, I need to be seen right now, that is not fair to you because I have budgeted this time for you and you budgeted this time for me. And so we ask that you have the same respect for your fellow patients as well. We have some same-day appointments. There are times when people cancel their appointments or they deliver and they don't need their appointments anymore. And so if you're calling at 9 in the morning saying, I'm not sure, I think I need to be seen for this, and we determine it's something that could wait, like we have an 11:40 slot here, we'll tell you, yes, let's add you to the schedule there. Now, if we look at the schedule and say, actually, there aren't any appointments today, or if you're calling for something that is more urgent, like I'm not feeling my baby move. You're calling me at 9:30 saying that, and our first appointment isn't until 3:30 in the afternoon. We're not going to make you wait until 3:30 because you don't feel your baby move. So if when you talk to Kylie or Jennifer, they say, that's actually an urgent matter, you need to be seen at urgent care, like chest pain, shortness of breath, or not feeling baby move, you need to go to labor and delivery. That's not us saying we don't want to see you or refuse to see you in the office. It's us saying, yeah, we agree this is an urgent matter and it shouldn't be sitting in our lobby for 6 hours waiting to get worked in. When you do call, the providers are not able to leave appointments to take patient phone calls. You have, again, we promised you the 11:40 spot to talk to us. It's not fair if somebody calls in the middle of your visit and we go leave your visit where you have valid concerns and you want to talk to us to prioritize what they are calling in about. So you have to leave a message in order to receive a call back. You'd be surprised how many people pocket dial the office. So if you call and hang up and call and hang up and call and hang up, you won't get a call back. Please listen to the entire message because if you just need front desk, that's actually the last thing to select on our outgoing message. So as I mentioned, Jennifer and Kylie kind of trade off between pregnancy administrative things, including filling out letters and forms and taking your triage calls. So if you're calling with a clinical issue, there are a lot of things that people call with over and over all day, and they know the answers to those off the top of their heads. But if there's something that they need to talk to one of us to get an answer to, leave a message or talk to them, they'll find an answer and get back with you or have one of us get back to you as well. Naisha is our OB clinical coordinator, so many of you have had some interaction with her with regard to scheduling things or referrals. So if you need to see the high-risk doctors, the cardiologist, hematologist, or what have you, Naisha is the person who helps to get those visits coordinated and get the reports back for us to review. At the end of pregnancy, if your delivery, C-section, version, induction, whatever needs to be scheduled, Naisha is going to be your go-to person as well. And then most of you met Renee, not Tiffany. Renee, when you watched the video with her when you came in for your confirmation, today is her birthday, actually. But if anything changes with your insurance, somebody goes to the ER and you think you met your deductible and shouldn't, don't need to pay here anymore, reach out to Renee. We can rerun everything because it's not our intent to over collect. So just let us know. After hours, there is always someone from our practice on call for our practice. You just call the same number that you call during regular business hours, the 674-0022. But you've reached the after hours line of Full Circle Women's Care. And that is who you call if you think you need to go to the hospital. So she's not who you call if you say, oh man, I can't remember what Brianna said at my visit today. Let me have them go look at my chart. This is the person who is in the hospital taking care of people who are actively laboring and having other pregnancy concerns. So she's who you call if you think you need to join her in the hospital. And again, you have to leave a voicemail in order to get a call back because the way the phone is set up, it does not register that it rang unless you leave a voicemail. Patient portal is also a way to reach us, but remember, response times can take 2 business days. So if you send a message on a Thursday and the next business day is Friday, the next business day is Monday. So if it's not something that can wait from Thursday to Monday, it shouldn't go on the portal. If it's a non-action item like, oh, just wanted you to know this, that, or, I wanted to change or update, whatever. If it's something that we can respond and have a conversation about, it may be postponed into your next appointment. Can I take this supplement or that supplement? If it is something that is, the portal is actually best used for things that have an action item. I lost my lab slip. Can you send me another one? I need a letter for my dentist or what have you. I have an upper respiratory infection, need to convert my visit to virtual. As long as there's 2 business days before whatever action it is you need, because sometimes y'all send me messages saying, I have a dentist appointment at 9 a.m. Can you send me a message? I'm like, tomorrow? So give us a little time, a little leeway on the portal so that we can respond to your concerns in a timely fashion. What we don't want to see on the portal, though, are urgent matters. So please don't send messages about blood pressure concerns. If you think your blood pressure is too high on a Thursday, it really should not wait until Monday for one of us to see it. That's a phone call. You should call the after hours line and talk to the provider on call. If you're not feeling your baby move, if you're bleeding heavily, things like that. Those are not portal messages. We also ask that you don't message every single one of us the same thing. There's a lot of us. It's called, we call it blitz messaging, and it is abusing the portal to have multiple people working on one thing. Had someone who was very upset. She went to the pharmacy and there were 5 prescriptions there for the one thing. And she's like, which one do I take? I'm like, well, really, if you just reach out to one person, you would get one prescription. Also, the computer, if they see cut and paste messages to multiple different people, will think that there is some breaching of a bot trying to spam us, and we've seen portal accounts get deleted with that. We also ask that you please do not attempt to have an appointment over the patient portal. The portal is what we do after we've seen patients all day, finished all our notes, reviewed all our ultrasounds, reviewed all our labs. We would like to now spend time with our families. If there's something quick that we can do, send a message to Naisha or Kylie or someone to get them to work on something for you the next morning, sure. But if it is, hey, can you take a look at all these labs and give me the pros and cons of the different treatments? That's a visit. So please text yourself those kinds of questions and schedule an appointment so that we can talk about them during our regular business hours. All right, ultrasounds are also released on the portal, and we use the portal for ultrasounds unless there is something urgently abnormal that we see on the ultrasound, and then in that case, we don't let you leave the building. Otherwise, we don't get the reports immediately. The medical assistants have to download it after the techs finish their report. They send it to your chart, divide it among us. We review them and send it out to you within 2 business days. So if you see the tech typing, furiously on your ultrasound report, don't go to your car and say, what's on my report in the portal? We don't know yet. If you know, though, that your anxiety is not going to let you wait 2 business days to find out what's on the report, I encourage you to schedule your prenatal visits on the same day as your ultrasound after the ultrasound, because the tech can print out a preliminary report so that we can go over whatever thing that you were concerned about. Like, say you wanted to know if your placenta is still in the right place, or if baby's growth has picked up or hasn't. They can print out just a little preliminary slip so we can answer that one question, and then you'll get the full report later. Quest and Natera also have patient portals, and because of Affordable Care Act, they send the results to you at the same time as they send them to us. You get them at 1 o'clock in the morning and then send them to us saying, "What's all this red on here? What's wrong? I've been Googling and now I'm concerned that I have." Okay, first of all, take a deep breath. When you see the red on the reports for Quest, it doesn't necessarily mean that it is abnormal. They're using non-pregnant reference ranges. Pregnancy reference ranges are different. There are some changes that occur in your body that make some liver enzymes lower and make other parameters higher. So give us a chance to receive the labs from the lab that we sent it to, and then send it out to you. Don't upload your version of it, because we still need to close the loop with that lab that says they received our order and we received their results. Question I have here now is, when should blood test results come in? I received a prescription alert from my pharmacy, so I assume my results were abnormal, but I haven't seen a report yet, just the ultrasound pics. If you did blood work here, you should be able to go into your portal into test results and see the results, and they will typically have a message on them explaining, "I'm sending a prescription for so and so." Let me know if that did not happen, the person who just sent that, because usually that's the reason why we send the results, is because of some lab that came in. And we usually release the lab at the same time as we send something to the pharmacy if needed. The most common reason, though, for us having a delay in receiving labs is if you're using two different names at the different facilities. So if you have not changed your name yet for whatever reason, or your insurance doesn't have your updated name, we ask that you use one name. Um, and because we don't have a fax machine here. When reports come in, they go to Massachusetts. And if it doesn't have your name and your date of birth, like first and last and everything matching, it's not going to sort into your chart. It goes into this arbitrary hold bucket, and we have to go searching for it. So ideally, whatever name you're using should match your insurance information too, because when you use alternative names, it guarantees delays. So the message that I have here, the question I have, it didn't, no, I mean, send me a message in the portal so I know who you are. And you can, and we'll look and see whether or not those results are in. All right. Any questions about how to contact us? Great. Wonderful. All right. What to expect at your prenatal visits. So first thing, expect that you had a lot of questions over the last 3-4 weeks, however long it's been. And when you get there and you hear your baby's heartbeat, you're going to forget all of those questions. So start a text thread with yourself with all of your questions, so that you can ask them. I love it when I get to the end of your prenatal visits and I'm like, all right, we've finished my agenda. What else do you have to talk about? And I'll pull out your phone and you say, oh, I do have some questions. We want you to wear loose, comfortable clothing so that we can access your belly, because we will listen to your baby's heartbeat at every appointment. Not an ultrasound at every appointment, but we will hear the heartbeat on the Doppler at every single visit. Please get here about 5 minutes before the scheduled appointment time, so that you'll have time to check in, handle any business at the front desk, and if you need to, leave a urine sample. So we do not collect them from everybody every single time. We used to, but the American College of Obstetricians now says that it's not required. So you'll know if you need to leave one. We typically tag your chart. And it's usually people with blood pressure issues, and we're looking for protein in your urine, blood sugar issues, and we're looking for glucose in your urine, or if you had a recent urinary tract infection and we are checking to be sure that you are cured. If you're 10 minutes late, we still have time to check on you and your baby, but obviously that leaves less time for our little text thread. If you're 20 minutes late, you have missed the entire appointment. We may be able to work you in later in the day if someone else, like front desk is really good at looking and saying, oh, she's going to miss that appointment with Brianna. Let me slide her over here to Vanessa real quick. If that time doesn't work for you, then just, we can always reschedule to another day that works better for both of us. So ultrasound visits. When am I going to get another ultrasound, Dr. A? Great question. So diagnostic ultrasound visits are separate from your prenatal appointments. We typically do your confirmation ultrasound between 8 and 10 weeks, as you'll see in a moment, and then we do your ultrasound, your anatomy ultrasound, around 20 weeks. If you have twins, we do it a little bit earlier than that, around 18ish. So the way to know whether you have an ultrasound coming up is to look in your portal and see if you have more than one appointment time on the same day, and is there a provider's name associated with your visit. So Tina Test, who is my imaginary patient, logs into her portal and she clicks on appointments. And Tina sees that she has two appointments on the same day. The first one is at 9:20 with ultrasound, which is not a provider's name. And the second one is at 10 o'clock with Dr. Yeckel, which is a provider's name. So Tina knows she's going to have an ultrasound on this day. And then the tech can print out a preliminary report for Dr. Yeckel to go over it with her. So she'll be able to tell her family when they should come to see the baby. And then Tina knows that the full report will be sent to her portal within 2 business days, unless there is something urgently abnormal, in which case we will not let her leave the building. This is our one exception where we do break our schedule. Someone will come and talk to her and make a plan, typically with Naisha, to get a referral to the high-risk doctors going. When you're checking out of your appointment, so say you're 16, 17 weeks and it's time for you to schedule your anatomy visit, let the front desk know when you're supposed to be scheduling a prenatal visit and a diagnostic ultrasound. We send notifications up to the desk to let them know what to schedule, but sometimes y'all are fast and you get there before our messages do. So just be sure you're getting more than one appointment time if you know you're supposed to have an ultrasound and a regular prenatal visit. Now, if you're not due for an ultrasound, but you just want to see your baby because it's your baby and that's fine, you can look at your baby. There are boutique ultrasound places all around the city. These are just a couple for informational purposes, not endorsing anyone over another. But I know there's one in St. Augustine too, if I have anybody down in the South. So, but just they do all sorts of cute stuff. They put the little baby's heartbeat in a stuffed animal and all sorts of cute things. So you can do these boutique ultrasounds anytime that you're not medically in need of doing one, but just want to see your baby. And a lot of them do gender reveal packages as early as 14 weeks. So that's just something to know as well. All right, we are going to flip over here to Full Circle Jacks. Let me know if you're able to see our website, fullcirclejacks.com. Give me a thumbs up if you can see it. All right. Okay, very good. Okay, we're off to the races. So this is fullcirclejacks.com. So this will be out or as long as the practice exists. For those of you who were with us before when we were delivering at Ascension and you're wondering what was behind our move to HCA, we still have this banner up here and you can click on this blue to go to YouTube and see the town hall that I held in October of 2023 explaining how we got here. All right, let's click on providers first and see who you're going to be seeing here in the office. All right, so this is me. That's my partner, Dr. Marrow, my partner, Dr. Yeckel, and Dr. Mooney. These are the midwives. There's midwife Lauren. I'll come back to her. There's midwife Norma, you won't see in the office. She works labor and delivery. There's midwife Jordan, midwife Brianna, midwife Jackie, and then Vanessa is our PA who scrubs for belly birth right now. So if you are anticipating having a scheduled cesarean, then she is who you're going to be seeing. Over here under patient information, so this is where we're going to find the most of what we're going to go through right now. Under the obstetrics tab, you will see lots of good things. One is their delivery stats. So are you a first-time mom wondering what's the chance of me ending up with a C-section in this practice? We're very transparent about our numbers. Some years are better than others, but you can take a look and see if you're a mom who's had a cesarean before and looking for a VBAC, what's your chance of having a successful vaginal birth after cesarean with our practice. So take a look there at your leisure. We're going to start though here on the prenatal care timeline. So everyone has had their confirmation visit, which again, we like to do our confirmations between 8 and 10 weeks. So typically 8 weeks is after most chromosomal issues would have happened that lead to miscarriage. And then 10 weeks is before your genetic testing would be due. So that's kind of our little sweet spot for confirmations. You'll notice also here we have lab transparency. So what things we intend to order at what gestational ages. So typically, right around this time, you come in, have your ultrasound, meet with the midwife, and meet with Renee and go over any boring insurance stuff. Set your due date, and then you have a virtual visit with me, not on this platform, but on Doxy, where we go over your medical history, your genetic history, and your pregnancy history. According to that, if there are any additional labs that I would like to get, we talk about those, and I get those ordered then. Otherwise, these are the standard labs that everybody gets. These are the ones recommended by both ACOG and Duval County Health. And your homework. Now we're getting the blood work done here in the office, so that makes things a lot easier too. If you decide to do the optional genetic testing, the NIPT, that is done. You have to be a minimum of 10 weeks. So we can bring you in anytime after your confirmation at 10 plus weeks to get that done. At this point in pregnancy, we're seeing you every 4 weeks in the office. So roughly 4 weeks after you had your first prenatal visit, your confirmation visit, you're back here for the OB physical. And the physical is just like it sounds. It's a physical exam. So we listen to your heart, listen to your lungs, do a breast exam. We may do a pelvic exam if there's any reason to do a pelvic exam. But a pelvic exam does not necessarily include a PAP. The PAP is the screening test for cervical cancer, and those are only done every 3 years. So if you're due for one, you're welcome to have us do it, but it's not a part of the standard ACOG panel. Cervical cultures are a part of the standard panel, but those can be done with a self swab if that's how you want to collect them. You and your midwife can talk about those at that visit. If you have a high risk issue, which we would have identified when I saw you for your medical and pregnancy history, you will typically receive a referral to the maternal fetal medicine group. And they usually see people between 12 and 14 weeks unless there's some other extenuating circumstances that they see you sooner. So again, every 4 weeks. So after this visit, you're coming back to the office for just a routine second trimester visit. Not a whole lot goes on here. It's mostly conversation about what changes to expect in your body during second trimester. Because this is when you start feeling the baby move, if you've never felt a baby move before. For first-time moms, it's 16 to 18-ish weeks or so. And for second-time plus moms, it's a little bit more. It's a little bit earlier, rather. So 20 weeks I mentioned is typically when we do our fetal anatomy survey. So that is the ultrasound. And if baby is cooperative, if you didn't do the NIPT, the genetic testing, this will be your first opportunity to find out whether it's boy or girl. You'll also see here in the middle the mental health screen. So that may actually happen at any point after your first visit here, because we like to screen a few, so postpartum depression and anxiety get a lot of press, but there's antepartum rage, anxiety, and depression that can clue us in on who's going to have more issues postpartum. So we like to get ahead of this and kind of be proactive in our treatment rather than reactionary after you're already suffering. If you're meeting with one of the midwives around this time, she's going to be talking to you about childbirth education classes and or breastfeeding classes. So again, 4 weeks later, you're back in the office and we're looking at the glucose test. I know I'm going to have questions about glucose, so we'll put a pin in that and I'll come back to it shortly. Antibody testing for moms who have a certain blood type. And if you are Rh negative, which we'll talk about when you get your result back, this will only apply to 10% of you. We'll make sure that you, if you need to receive RhoGAM during pregnancy, that you get it as well. This is when we're going to have you pre-register at the hospital. So now everything is online. Yay. So there's a QR code at the front that they'll have you scan to register at the hospital. And you'll use information like who's your doctor. You can use my name, Dr. Merrow, Dr. Mooney, and you'll put your due date in for your pre-registration dates. You'll want to at least be sure you're touring the hospital by your third trimester. And if you plan on working with a doula, which we'll talk about in a moment, you definitely want to have her selected by the end of your second trimester. So now we're moving into third trimester. Yay. And this is when it picks up. We start seeing you every 2 weeks after this point. First-time moms, if you have not already selected your pediatrician, this is when you want to start looking around to see where you're going to take your baby. Veteran moms, you want to decide whether or not you're going to stay with the same pediatrician. Vaccinations, if you plan on getting boosters to help with passive immunity during breastfeeding, early third trimester is the best time to do them. We don't give them here in the office, but we can write prescriptions if you need them at your local Minute Clinic or wherever, whatever pharmacy or Publix, whatever, wherever you plan to go. You have here in the middle the option to repeat or decline your standard prenatal labs. Not a formal ACOG recommendation, American College of Obstetricians, but Duval County, with its different high risk populations, does have that recommendation in place for those who may be at risk of contracting STIs during pregnancy. If you don't feel that applies to you, you can decline it. There's an easy form for it. So again, this is when we start seeing you every 2 weeks. So moms who have certain comorbidities, some other issues that happen with their pregnancy, like high blood pressure or diabetes, we start doing additional testing after 32 weeks. If you know that you're going to have a belly birth, which is our term for the C-section, we start getting your date on the books when you are around 33 weeks. Our belly birth moms deliver between 37 and 39 weeks, kind of depending on their personal circumstances. At 36 weeks, we do another pelvic to screen for group beta strep, again, collecting another swab. And again, if you declined your repeat STI screening before, you can also decline your repeat cervical cultures. But 36 weeks is when we start seeing you weekly, all right, because you are full term at 37 weeks. Your due date is 40 weeks, but you're full term, considered full term at 37 weeks. So this is when we start seeing you every week. And this is when we want you to bring in your birth plan so we can go over it together, set some expectations about what happens in the hospital, start your natural cervical ripening methods, which I'll go over in a moment. Belly birth moms are all off the train by 39 weeks. And then here comes your due date, and everybody you know is calling you saying, "Did you have a baby yet?" Like you would forget to tell people you had a baby. So be patient and tell them to be patient too. But we do like to have all of our passengers out by 42 weeks. So for first-time moms, your average length of labor is 24 hours. It is. It might take us 24 hours to get you into labor, so we start inductions for you at 41 weeks and 5 days because the risk of stillbirth goes up drastically after 42 weeks when the placenta starts to give out. At 41 and 6 for second-time moms because your labor is usually half the length of whatever your first labor was. So prenatal care timeline, print it out, highlight, stars, know what to expect when you're coming in. All right, next, pregnancy safe medications. You will need this list usually at 2 o'clock in the morning. Ask me how I know. So if you are experiencing some of the sexier symptoms of pregnancy that nobody really talked about, constipation, gas, all that good stuff, I have listed here in alphabetical order the common discomforts of pregnancy. What you'll see here in the middle are the relief measures. So if you send me a message saying, "Oh my gosh, Dr. Adams, I am so dizzy, I don't know what's going on," the first thing I'm going to ask you is, have you tried everything on our website yet? And some of y'all have gotten smart and y'all send the first message says, "Hey, Dr. Adams, I've tried everything on the website and I am still having insert problem here." So if you have exhausted everything in both of these columns, because over here are medications, things you can go to the pharmacy and pick up and are safe in pregnancy, then please definitely reach out to us because it may be time for us to evaluate you because it's maybe some underlying condition that's leading to that symptom, or you might need a prescription, something. So remember that that is out there. Next is a gestational diabetes screening test. Remember I said I was going to come back to gestational diabetes? It's not right now, but just know that this is out here. This is information that you will need when you are around 24-ish weeks because it tells you how to prepare for the test. It tells you what the patient-driven options are for taking the test, and it gives you lots of good information before you go to the lab. Weight gain in pregnancy. Some are very concerned that they have no appetite. I've never not been able to eat before, Dr. Adams. Don't worry, it will come back. It will. So how much weight should you be gaining during pregnancy? So there's a link here you can click to put in your pre-pregnancy height and weight, and it'll give you your body mass index, which tells you what your recommended weight gain is in pregnancy. If you're having twins, you can add 10 pounds onto the upper number here on the side. But what I really want to focus on here is that your rates of weight gain are in your second and third trimester per week. So if you lost weight in your first trimester, don't let it stress you out as long as you're gaining your appropriate amount in your second and third trimester per week. Also, if you have been off to the races and really emotional eating in your first trimester and you've already hit your pregnancy goal, this is a good sign to slow down because we'll talk about what happens with excessive weight gain in pregnancy in terms of risk for cesarean. Birth preferences. So we talked about bringing in your birth plan after 37 weeks when you're full term. First time moms, you've never done this before. So, doing something unpredictable and so important can bring some anxiety. So, sometimes writing down or really having an ability to concretely express your ideas can help to decrease that anxiety. And that improves your birth experience, being less anxious. So this just kind of breaks down every little piece that, opinions are okay. There's nothing medically wrong with choosing anything that's on here. So a couple of things to highlight. We do have obviously continuous monitors with the wires, but we also have intermittent monitors. We have wireless monitors to include free movement. For pain relief, obviously it's a hospital, so we have epidurals and IV pain medicine, but we also have tubs in which you can labor. Nitrous is in the hospital, and we are still working on the policy for it so that can be available too. And we're hoping that we have that by the time you guys deliver. But also want to highlight, we're not strapping you to the bed, starving you, and all that stuff. We want you to keep your energy up, keep your blood sugars up, labor in any position, make the baby an active participant in this, wiggle that baby down, push or deliver in any position. That's all fine. Delayed cord clamping and immediate skin to skin are standards. Let us know if you plan to keep your placenta. These are the routine medications that are offered to the newborn. You always have opportunities at your visits to come in and ask the midwife, what is this? What is it for? Does this apply to me? What happens if I don't? And then feeding, breastfeeding. Again, we have an amazing lactation consultant there who rounds like on demand, like you don't even have to ask for her. She just comes around and checks on everybody. And then twins, if you have another person in there, there are some things that you may want to be looking at with regard to your delivery and belly birth. We do gentle cesareans, family-centered cesareans at our facility. And so if you're expecting that you're going to need one, we'll go through what the elements of that are for you. So 21 boxes on here. Not all of them apply to you. So just take it one by one, like per week. We start at 16-ish weeks or so, and then you should be finished with it by the time you are full term. All right, next, cervical ripening techniques. Again, something you will not need for a while, but at the end of pregnancy, everyone says, how do I make this end? How do I get this baby out? And so these are things that you can start doing, like you can start the raspberry leaf tea at any point, but all of these are the summaries from evidence-based birth. So if you want to go out and scour the internet and look for all the things, it's fine, but you're going to find this stuff on the evidence-based sites. What you will not see on here is castor oil, and you can ask your midwife when you see her at a visit why castor oil is not on here. I'm sure she'll be happy to explain that one to you. Points for distance is probably a phrase that you'll hear. All right, first time moms. Give me a thumbs up if you're a first time mom, or a heart or something to let me know, one, that you're still awake, and two, okay, cool. All right, what about VBAC moms? Do I have any moms on here who had a C-section before and are looking for, okay, cool. Awesome. All right, you guys are in very similar boats. So VBAC moms fully understand too that sometimes labor doesn't go the way you thought it was going to go. First time moms, it can be a real kind of gut punch to find out that things aren't going the way that you want. So our first lesson in parenting, because my first one, I was like, oh, going to deliver vaginally. I would push 3 times, and yeah. Anyway, had a C-section and then became a VBAC mom, which is why VBAC moms, I'm rooting for you. So control what you can, because babies are going to baby, and there's some things that we cannot control. If your baby comes in and looks scary on the monitor and we're afraid that, we're in danger or distress here, then, we want to keep you safe. We know that's all of our number one priority, but you can't control that part. What you can control, though, are some things about how baby is positioned in your body and how your body is prepared for labor. So you can see a bunch of tried and true recommendations in here, and we'll go through some of these in upcoming slides. We'll talk about squats a lot. Watching your weight gain, having an experienced doula. Don't cheap out on the doula, because they can be the difference between, a great birth and, just a finished birth. And then avoiding non-medical inductions is especially for our first-time moms because y'all get really, really tired after 39 weeks and you say, I just want to meet the baby. I don't care. Again, we're going to keep you pregnant as long as it is safe to do so because we want to give your body a chance to do it on its own. But trust us, I literally put my stats on the internet because I don't like having bad stats. So it's not my goal to C-section everybody because that's not the right thing to do for people. So trust that if we're recommending something for you, it's because we've done this before and we want you to get your best outcome, the best possible way. If you have a little guy and you want to get him circumcised, we do those in the office, not in the hospital. So what will usually happen is after you have the baby, we'll verify with you, do you want a circumcision or no? If you do, then we'll let Naisha know and she'll make his little appointment. And then she'll send you a portal message with his appointment date and time. All right, we are headed back to the presentation. So let me know if you can see the mocha monstrosity and the coffee on the page with the heart or okay, awesome. Okay, so for first trimester, if you're saying, oh my gosh, how am I gaining so much weight? All I'm drinking in the morning is coffee. Are you? Or is it coffee? Did you know that pregnancy only requires an additional 300 calories per day? So whatever auntie is handing you a second plate saying, oh, you're eating for two now. Back up, auntie. Only need 300 calories. It takes 10 calories to maintain 1 pound of body weight. Your goal weight gain, remember, is based on what your starting body mass index is. So let's say you're starting the pregnancy at 170 pounds. You need net 1,700 calories to maintain that, okay? If your goal, based on the BMI chart, is to gain 25 pounds, hey, you get an additional 250 calories for a total daily caloric intake of 1950. Divide that between breakfast, lunch, and dinner, and that's 650 calories per meal. So again, restaurants are doing this nice, nasty thing where they put your calories on the menu. And what you'll see is a lot of these meals are actually like 2,000 calories a piece. It's a whole day's food. The other thing is drinking your calories. So once you've eaten your 650 calorie meal, you cannot wash it down with a 570 calorie mocha monstrosity from that Starbucks page on there. This page of nutrition facts just kind of tells us where should those calories be coming from. It's a really busy slide, but the take home here is just making sure that we're dividing the calories appropriately between carbohydrates, protein, and fats. Next, I swear I've eaten so healthy and calorie counting ever since I found out at 5 weeks, and I've gained 8 pounds 4 weeks later. Could it possibly be bloating and water retention, or am I just doomed? Yes, it could possibly, no, you're not doomed, but yes, it could possibly be bloating and water retention. Progesterone plays a very heavy role in the first trimester, and it also contributes to water retention. So the other thing that I will say, don't over obsess over it. Like if you see you're spiraling out of control, that's one thing, talk to us. But your body's going to do what it needs to do to support a healthy pregnancy. I did 3 different things in all 3 of my pregnancies. The first one, it was caution to the wind, no cupcake was safe. I ate everything. And I gained the exact same amount as in my subsequent pregnancies when I was sick every single day and couldn't keep hardly anything down. And then the third pregnancy when I was trying to eat my fruits and vegetables and stuff. So as long as you have it on your radar and you're trying to do what is healthy for you, your body's going to take over. So don't over stress it. All right, good question. This little slide over here is just the second part of the slide actually is just to highlight how small changes can make a difference. So watching that sodium, switching from traditional sauce to 20-minute herb infused marinara cuts 500 milligrams of sodium out. You will hear me in your third trimester when those rings start to get real tight and you're sending messages like, how do I? And I say, how much sodium did you have last night? All right, so what should you be eating? Fruits, veggies, whole grain, cereal. You're not going to give your baby a nut or dairy allergy by eating those, so please feel free. For my coffee drinkers, you want to keep your caffeine at less than 200 milligrams daily. Keep in mind, 200 milligrams is still a lot of caffeine. Caffeine is also a natural diuretic, so if you're going to drink coffee, be sure you're drinking 3 times as much water as whatever caffeinated beverages that you're taking in. Herbal teas are fine. We listed here my favorite ones for pregnancy. And for my vegetarians, pescatarians, vegans, be sure you are getting your 70 grams of protein a day. There are some pregnancy diets that will tell you to take in 120 plus grams of protein a day. You can do that, but you're probably going to grow like a 10 or 11-pound baby. So 70 grams is just fine. Please and thank you. You can have deli meat. Just be sure that you are microwaving it for 30 seconds to be sure that you're getting rid of any harmful bacteria. Cheeses, if you're eating soft cheese, be sure it's made with pasteurized milk. If you're at a restaurant and you can't verify whether or not it's, made with pasteurized milk, then skip it for the evening. But if you're at Trader Joe's, you flip it over and it says pasteurized milk, you're good. For canned tuna, you can have 3 4-ounce cans per week. If you are a pescatarian and you need to know more about other fish, the FDA has a great document out. This is the latest version of it as of last week, October 2021. But it tells you what fish you should eat in larger quantities because it's high in DHA, which is good for baby's brain development, which ones to eat in moderation because they're kind of neutral, and which ones to avoid because of methylmercury content. Either way, you want your fish to be cooked all the way through. So avoid the yummy ahi tuna and the medium rare steaks. You're going to have to ruin your steaks for the next 6 weeks and make them well done. For my kombucha drinkers, my kimchi eaters, sauerkraut, all these fermented types of foods, you just want to watch your intake on them. There's no set amount, but just remember they're fermented. And so fermentation is the same process we use for alcohol. And so just want to be careful with those. Alcohol is a please avoid because we don't know how much alcohol at all causes fetal alcohol syndrome, but we know there's a definite outcome with alcohol. And then you want to limit your sodium to 1,500 milligrams a day. And if you think back to your Urban Fuse marinara, cutting out 500 very easily is a good habit for life. All right, so there are no questions about food. We're going to move into exercise, and it is fine for you to continue whatever you were doing pre-pregnancy, unless what you were doing was nothing. No judgment. In the second trimester, though, you're going to feel better about it. Like everybody's tired, everybody's out of breath, and all the things in first trimester. You're going to increase your blood volume by 50% in second trimester, and that adds more oxygen, tension, and saturation to accommodate more of that aerobic activity. So just listen to your body. If you're upset, like I can't even walk across a parking lot now, and I used to be able to run a mile, it's okay. It will come back. If you weren't doing anything before, it is okay to start a new regimen. It doesn't have to be anything really crazy, but do remember a sedentary lifestyle. If you are not exercising and moving around consistently during this pregnancy, your baby will settle into your pelvis in a weird malpositioned way. And that, my friends, is the most common reason we're doing C-sections. Not babies too big, not babies in distress. It is the baby's spine is toward your spine instead of being toward your belly. Like the head is down, but we're turned what we call sunny side up. For those of you with these cute little Fitbit watches, your resting heart rate is going to go up by 10 to 20 beats per minute. That is normal. If you're not getting dizzy or lightheaded or passing out with it, that's okay. It's a physiologic change of pregnancy and it is fine. If walking is your new exercise, congratulations and welcome. Just know that your heart rate needs to be in the aerobic zone to consider that actual aerobic activity. And the aerobic zone is 220 minus your age. The question I have up here is, are heart palpitations / flutters normal? They are common, but not normal. Sometimes they're a sign of dehydration. Sometimes they're a sign of decreased electrolytes. So you can drink things like Gatorade or Pedialyte or that liquid IV stuff that has the electrolytes in it. If you are fully hydrated with good electrolytes on board, let us know because, again, it is common, but sometimes the increased cardiac volume can bring out underlying cardiac issues and we have to get a cardiologist involved. So just keep an eye on it with appropriate hydration and electrolytes. So 220, let's say you're 30 years old. So 220 minus 30, if you are 30 years old, you shouldn't be exercising with your max heart rate above 190 for extended periods of time. Your aerobic zone, however, starts at 70% of that, so 133. So your heart rate should be between 133 and 190 when you are exercising for 30 minutes, sustained 3 times a week. That is aerobic exercise, and that is what you need to make sure that your body is moving well enough for baby to get all the proper nutrients and feed that placenta. So what exercises are good for that? You can do cardio, all the things listed here. If you were lifting weights, lift up to what you were lifting at your pre-pregnancy. You do not need to increase your resistance during pregnancy because your baby and your body are going to do that for you. Squats. Remember I said we were going to talk about squats? They are my favorite. A minimum of 50 squats per day. So if you're already an experienced squatter and you're doing more than 50 squats a day, carry on. If you've never squatted before, at 20 weeks, you start by giving me 5 a day. 21 weeks, you give me 10 a day. 22 weeks, you give me 15. And we're building up to a minimum of 50. And they don't have to be all at the same time. Just throughout the day, you can just drop into a squat and pick it back up. But squats help to get that pelvis open, get those muscles long and lean, and help that baby descend in the pelvis in the right position. Pilates and yoga also, again, lengthening and stretching those muscles and opening the pelvis. And any experienced instructor will be able to tell you what the pregnancy modifications are. So things you want to avoid: high intensity interval training after first trimester. The intervals are fine. It's the intensity. So you can do the low impact versions of these exercises. Lying flat on your back for extended periods of time, like excessive ab work. So you can do side lying abs, you can do standing abs. If you're not a hot yoga instructor who is fully acclimated to hot yoga, you will probably get very dizzy in hot yoga, and so we don't recommend try something new during pregnancy. Please don't. Scuba, we say avoid because of the barometric pressure changes. Same thing for high altitude hiking. You can visit your family in Colorado, 8 to 10,000 feet above sea level, but increased oxygen requirement of exerting yourself with them. Just don't go hiking with them. Contact sports, this is also not the time to take up kickboxing. We also had some pickleball incidents. So just in general, anything with a ball flying at you, maybe you want to avoid during pregnancy. Outdoor biking after 16 weeks is not a no. It's just a be careful, because your center of gravity will start to change at 16 weeks. And as you try to turn corners on the bike, you may find that you're just falling all the way over. So it's not a no, but just know that you kind of weigh yourself out on a different plane. Okay, so we have talked about nutrition, we talked about exercise. Now let's talk about gestational diabetes, because you cannot prevent gestational diabetes by just watching your diet and exercising every day. You can help to control it, but you cannot prevent it. So we have to screen everybody, because your number one risk factor is the placenta. The unexpected supervillain of the pregnancy. The placenta gets so much credit because it takes the nutrients to the baby, clears all the toxins, protects the baby and all that stuff. You know what else your placenta does? It gives off hormones that tell your insulin not to do its job. So the job of insulin is to clear your bloodstream of excess glucose. But if your placenta is saying, hey, insulin, call out sick today, let that glucose ride. Now you have extra glucose in your bloodstream. And you know what that is? It's diabetes. But it's diabetes because of your placenta. So it's gestational diabetes. So if you don't have a placenta, I won't screen you for gestational diabetes. But if you have a placenta, then I really should. And if you have twins, you have 2 placentas. So I'm absolutely going to screen you. For my moms who say, no, but I don't eat any sugar ever. You eat good carbohydrates, fruits, whole grains. Don't avoid those prior to the test, because you'll give yourself a false positive and end up, having to do the full diagnostic test. If it is the drink itself that bothers you, remember on the website I said you won't need this paper for another couple of months. That paper tells you what the options are for glucose screening. So again, if the drink is bothering you, if you're like, chemicals, don't worry. I have the Simply Pure drink right here in the office. It is soy-free, it is dye-free, it is gluten-free, it is BBO-free, it's kosher, it's vegan, it's offensive to almost no one. It's just glucose. There are other additional patient-driven stuff like the fresh test, Glucorganics. Those are all on the website on that box that I showed you under patient information. So one day you will labor. Or deliver it at least. I have a 100% delivery rate, whether labor or not. I've never left one in. Childbirth education classes help to prepare you for labor and for birth. So what's listed on here, again, informational purposes, but I think what's represented on here, we have hypnobirthing, hypno babies, Bradley method is on here too, and then a class for partners too, because don't say the wrong thing, because pregnant women get really strong in labor, and what you don't want is to get pinched by an angry pregnant woman because you said something crazy. Preparing for birth. So breastfeeding classes, the La Leche League has them. Sonia at HCA is awesome. She does a breastfeeding class too, which you can sign up for on their website too. Every new parent should know CPR. Here is a link to CPR from the Red Cross. Even if you already know adult CPR, it's different for babies. And then lastly, Webster, if you're seeing a chiropractor already, good for you. That will help with hip alignment to get these babies in the right position. Please, please. Just be sure that he, she, or they are Webster certified. That's a special certification that has to do with the changes of pregnancy to make sure that your adjustments are appropriate for the changing pregnant body. Give me a heart if you're planning to work with a doula, if you've already contracted with somebody or you've been thinking about it or you just want to know more about doulas. Okay, cool. Awesome. Good, good, good. I had doulas in my second and third pregnancy. Didn't in my first one, and I had a C-section. So, study of N equals 1. What's a doula for? I have a doctor, I have a midwife, I have a nurse, I have, lactation consultant. I need a doula too? Yes, because doulas provide emotional support and physical support before, during, and after pregnancy. So helping you remember your breathing techniques, getting you in different positions to help that baby rock and roll and get in the right position and to relax during labor. Because being too tense can also self-sabotage what your baby's supposed to do. So it's not another person who's giving you clinical advice. They are helping you process your feelings about the medical advice and medical care that you're receiving from us. They're helping you process your feelings about the medications that we recommend and or your delivery. So the midwives know who the doulas are, who've been working with us for many years, and they can tell you if you bring the names in. Acupuncture and pregnancy massage, we recommend for a number of things. From as early as first trimester, acupuncture can help with nausea. Later on, it can help with the discomforts of sciatic or whatever kind of pains that you may get during pregnancy. Most of your insurances will cover breast pumps as well. So when you come in, on the walls in the exam rooms, you'll see the QR code that you can scan around your anatomy ultrasound. Is a good time to do it. When you go and find your own companies to get breast pumps, I promise you it takes a lot longer because they send all these different forms for us to fill out, and it just takes forever. This place, scan the code, put in your insurance info. They'll send you what your insurance covers. They'll write the prescription for us. All we have to do is sign it, and it gets sent back. You usually get your stuff within a couple of weeks. For those who need to use the Family Medical Leave Act for pregnancy, we are contracted with Leave Guru. It's a third-party vendor. If anyone's ever tried to get these forms filled out before in an office, it's sometimes like a 2 to 3 week turnaround. Leave Guru, however, completes them in like 24 hours or less. Some are done in like 10 minutes, which is amazing. So Kylie and Jennifer will help you get set up with that. Finally, after delivery, because you will deliver, blood pressure check for my moms who have any blood pressure issues during pregnancy. So first-time moms, listen up. 1 in 8 of you will have a blood pressure issue during pregnancy where you've never had a blood pressure issue before. That is a first-time mom thing, okay? So just know if it happens, we've seen it before, we can talk you through it, okay? After delivery, though, your risk is actually increased. So preeclampsia is more dangerous in the first 14 days after delivery. So we bring you back after delivery a bit sooner to make sure that your blood pressures are staying within a safe range for you. For my belly birth moms, we see you back at the 2-week mark. Routine mental health screening, again, 80% of you are going to have baby blues, which is very common. A little tearfulness, just a little extra sentimentality when you bring your baby home. If it persists beyond 14 days, though, we may be seeing early signs of postpartum depression, anxiety, or rage, and we want to get in front of those for sure. Postpartum doulas are angel people who live in this city who will come over and, for a fee, take your night feedings so you can sleep. And sleep is so important to in those first couple of weeks as well, while baby is figuring out night from day. The motherhood space is also a fantastic resource in Jacksonville. We're one of 5 cities in the country that received a grant to care more for our postpartum women. They have light therapy, group therapy, individual exercise therapy. It's at the Winston Y downtown. And if you're identified as someone who qualifies, because insurance does cover it, but it does there's no cost to you, and they have on-site childcare for babies 6 weeks to 12 years old. And then pelvic floor therapy is standard in many countries, and America is working on it. But we have that here in the office. So I have a nurse who comes in Tuesdays, Wednesdays, and Thursdays of every week. And at 8 weeks, we begin to put you back like we found you or as close to. It's for all those things we don't really talk about, like urinary incontinence afterward, pain with intercourse, laceration, healing. All of that is really helped by pelvic floor therapy. And your insurance covers it. Renee Hall already checked it when you came in. So random frequently asked questions. Yes, you can sleep on your left side. You can sleep on your right side. You can sleep on your back. If sleeping on your back makes you dizzy, though, get one of those wedge pillows off of Amazon. Just put it under one hip so you're kind of leaning like not flat on your back. You can help paint the nursery. Just be sure it's well ventilated or you're wearing a mask. You can take probiotics, prebiotics, postbiotics. You can dye your hair, including your eyebrows. You can do gel nails. If you are in a salon with a lot of fumes, you may want to wear a mask just so you don't get dizzy and pass out in there. Scare those people half to death. Car travel is fine up to 37 weeks. Just, it's not unsafe after 37 weeks, but you're full term after 37 weeks. And so you may end up having your baby in a place that is not here where full circle is, and you don't want that. Just be sure if you're traveling more than 2 hours, you're getting out and stretching every 2 hours to prevent pooling of blood in your lower extremities, your legs, and or blood clots. Flying is fine for twins up to 32 weeks, for singletons up to 36 weeks. Just be sure you are wearing your compression hose, medium compression, and drinking lots of water on that plane and doing your toe raises to, again, prevent the blood clots that can get to your lungs and actually be very detrimental. Skincare, you can use your benzoyl peroxide, your salicylic acid, your whatever, just nothing that has retinol in it. If you need a vitamin A alternative, bakuchiol, Bakuchiol, is your alternative. It is a derivative that is not harmful to the fetus. And because y'all will be pregnant during summer, no roller coasters, no water slides, and no jet skis. I don't have that on there, but somebody asked me that last week. No jet skiing. All right, upper respiratory updates. These are current. So for the vaccinations that I mentioned before in the early third trimester, ACOG strongly recommends them again to increase passive immunity and to keep you from having some miserable form of one of those illnesses when it's time for you to deliver. If you're getting a COVID vax, specifically Moderna and Pfizer are fine. We don't recommend Johnson & Johnson because of its independent risk of blood clots. So if you plan to get it, you're more than 6 months past Moderna and Pfizer, you can get another one of those. If you're more than 2 months past a Johnson & Johnson, you can get a Moderna or Pfizer because mixing and matching is fine. And if you're getting the flu vaccine, RSV, or Tdap, you don't have to worry about spacing or timing those out because they work differently. If you do get COVID, there are no formal recommendations for ivermectin, azithromycin, or Plaquenil. The things that we do recommend, and this also applies to RSV and flu, is that you, number one, don't come here. Please don't bring any of it. We are a well office full of immunocompromised pregnant women and staff that takes care of immunocompromised pregnant women. So please don't come here and start a little epidemic of your own. Convert to virtual appointments. We will still see you, check on you, talk to you, talk through any issues that you're having that day without endangering us and your fellow patients. These are the vitamin supplements that we recommend. If it's COVID specifically, we recommend low-dose aspirin because COVID has been associated with gestational hypertension in pregnancy. And as long as you control, like if you contract COVID after 36 weeks, don't start the aspirin because the bleeding risk won't be worth it. But with the risk for gestational hypertension, serial growth ultrasounds after contracting COVID in pregnancy are recommended. You only need to go to the hospital for any of those if you can't breathe or you have a fever that's greater than 101 that you can't bring down. For those of you who had your last baby during COVID, deep breath. It's better now. We're back to the regular number of visitors, which is four visitors plus your doula, who is not considered one of your visitors. She's part of the birth team. We're not routinely masking in the hospital. You're only asked to mask in labor if you are actively COVID, RSV, flu positive, again, to protect staff. and decrease viral load in the room. And even if you are, we're not separating from your baby. We give you an isolate to protect baby from your respiratory droplets and give you an N95 mask to keep you from giving it to your baby. All right, you did it. Amazing. Thank you for all the questions out there. Thanks for hanging with me. Remember, we are semi-social is what I will say, because I can't remember the last time I saw a post that we had out there, but still feel free to follow us because you never know. We may bring it back. All right. Well, thank you all for your time. Thank you for choosing Full Circle. And I always close this by saying, if at any point you have any concerns about what's going on with your care, I am accessible. This is my practice. I started it 12 years ago, and I am still intimately involved with every detail of what happens to my mamas and my families. So going to Google, going to Yelp will not solve your problem. I can actually solve your problem. So send me a message and I will work on getting an answer for you. Okay? We appreciate you, we love you, and we'll see you back in the office real soon. Bye.